So good morning, Jacob Roth. It's a real pleasure to have a conversation with you this morning.
Good morning, Dr. Stoltzfus. I believe this is the first time we've had an opportunity to have a conversation. It's a pleasure to meet you.
Yeah, it is. And let us know where you are. Where are we seeing you this morning?
Yeah, I'm chatting with you from my apartment here in the Bronx of New York City. So I live on campus at my medical school and just right in the thick of things as I found it the last couple weeks and months here
Right.
with COVID-19.
Yeah. And I'm here at my home in Goshen, which has become my little video studio these days. So welcome. Um, Jacob, maybe just to begin with, I just hope this conversation is a time for us to get to know one another and for our alums to understand a little bit about you as one of our recent Goshen College alums. If you would, just tell us a little bit about your experience, connect the dots between your experience at Goshen College and what you're doing now. So tell us a little bit about that story briefly.
Yeah. I guess so. I first arrived at Goshen College as I think more than a handful of students do with pre-medical intentions, and started out on a molecular biology and biochemistry track. I really enjoyed that and actually added on a chemistry major along the way. And throughout that experience, knew that I appreciated medicine and the patient interactions there, but was really excited by research, kind of spurred on by some interactions and research with Dr. Doug Sherrick, and then a few summer internships at the NIH and AbbVie pharmaceutical company. And that led me to taking a kind of direct step toward medical research after Goshen College. So I graduated in 2017, and that fall moved out to Maryland and started working full-time at the NIH at one of the institutes there doing biomedical research.
Right.
I had a blast there, and that led right into an MD PhD degree that I'm pursuing now.
Right. So which one of the institutes were you in at NIH?
Oh yeah, there's 27 wonderful institutes there, and I was at the National Center for Advancing Translational Science.
Okay.
NCATS.
Right. Translational science, which means like, how do we get all this discovery research, this cool basic research actually into the hands of practitioners?
Precisely. There's a unfortunate gap between the basic science that is really foundational and moving that towards something that's tangibly relevant to the clinic. So that's what we're attempting to address.
Yeah. Oh, wow. We could talk a long time about that because I stood in that gap in my global health nutrition research for many years, trying to work on that translation of knowledge into actual action that would help people's health and livelihoods. So that's really cool. Yeah, so chemistry. I was a chemistry major too.
Woohoo!
It's a great way to begin a career. I think it gives you a lot of fundamentals. So, and you're one of the folks who came in with pre-med intentions, and now you're in medical school. So huge congrats on that.
Oh, thank you.
Yeah. So, and you're in New York City, and as we are all acutely aware of the enormous impact of the current COVID pandemic on New York City, and I just wonder how and when that began affecting your life as a medical student. How is your work like different now than it was in December of last year, for example?
Okay, yeah, it's drastically different. I remember chatting with some classmates when the early news reports came out about just the COVID-19 or the disease in China. And at that time, most of us assumed that in New York City, we would see it at some point or another. And especially being up here in the Bronx, we have a fantastically diverse community and a wide presentation of disease here on a normal day, regardless of a global pandemic. It was in kind of February and early March where all of our classes moved to virtual classes. I think maybe at the end of February, all medical students were pulled out of the clinics. And at that time, I wasn't personally in the clinic, but some of my peers were pulled out of the clinics, and we proceeded with fully virtual classes. And the campus shut down. We followed the state's orders to, or suggestions to stay at home. And medical school changed quite a bit. We all stayed at home and participated via Zoom as we're doing now.
Yeah, yeah. I remember those days very, very well. And we in Indiana were hoping that this would stay more on the coast and not permeate every community, but now it is being transmitted in every community in the United States as well. So what does a day look like for you? What did you do yesterday, for example?
What did I do yesterday? Well, on the weekends, I have mainly been volunteering at the ER here at Weiler Hospital on campus. Starting about 2.5 weeks ago, kind of right in the thick of things when we saw our peak, I was spending a couple of the days of the week volunteering there in the ER, helping the doctors and nurses to put on their PPE and be best protected as they go into the ER, and then assisting with things in the ER as well. Just to reiterate, I'm only a first-year medical student, and I was not providing patient care, but was right there at ground zero for our response.
Yeah.
Yeah.
And when you speak about ground zero, just say a little bit about the Bronx. If I'm not mistaken, about the 5 boroughs of New York City, the Bronx has been the hardest hit of all the 5 boroughs. Is that correct?
That's correct. I think the absolute numbers in Brooklyn might be a little bit higher, but looking at the number of people and the percent that has been affected, the Bronx has certainly been the hardest hit. And I mean, of note, the Bronx is, I think, by the U.S. Census Bureau, the most diverse area in the United States. And there's also great inequality here in the Bronx, and that is well documented, and everyone knows that, and we're working to counter that. But the recent COVID-19 data and the racial and ethnic makeup of who has really been hit hardest by COVID-19, that lays just kind of to bear the social and economic disparities that are present in our community here. So
yeah,
been tough to see here in the Bronx, and yeah, we're trying to make it through.
Yeah, that's one of the aspects of what's unfolding that I'm so curious about, is how will we, I mean, the social inequalities and the health disparities in our country were known to us, but oh my goodness, how COVID is making those manifest to us in new ways. And I'm so curious and about how we will respond to that in the future, and hopeful that we will.
Yeah, and given your long career in research and work on public health, I'm curious as to how your thinking has changed, and it is maybe dynamically adjusting to this new COVID reality, and whether or not that might have any implications for health programs at GC.
Yeah. Well, in my own work, I think a lot about my work with the HIV pandemic, which is still a pandemic. HIV came onto the global scene when I was on SST in Haiti in 1983. And I remember being in Haiti and seeing the Newsweek that came out that summer, characterizing what we knew of the HIV epidemic at that time as the 3 H's: Haitians, homosexuals, and hemophiliacs. And what a tremendous amount we had to learn about HIV, and that it wasn't about the 3 H's, and it was something that I think has changed all of us. And it's good to be reminded that HIV is an ongoing, still global pandemic with a lot more tools now at hand than we had in 1983. But HIV is still being transmitted. It's a problem here in the United States. It's a problem throughout the world. So that's a really humbling story of a pandemic. It's been with us so long. But I also think about how much we have learned, again, about social exclusion and social inequality that really shaped the beginning of that epidemic, that disease story, and still does. But we're so much farther along, certainly in grappling with HIV than we are with COVID.
Yeah, thankfully there's been some wonderful treatments developed, and I think Goshen alumni has played a significant role in that. But
yeah, many have. And as you might be aware, we are in the process of starting a new undergraduate degree in public health with aspirations to build that to a master's in public health. So I think about that a lot. And if there was ever a time to bring attention to the need for strengthening the public health workforce in the United States and globally, certainly this is a terrible, terribly compelling lesson in the need for public health infrastructure.
Yeah, I agree.
Yeah, and health workers.
I didn't know that Goshen was implementing that. That's
yeah.
wonderful.
Yeah, hope to enroll our first students this fall into that program. You know, as a Goshen alum, one of the things that I was aware of throughout my career is how things I learned, and especially through particular relationships with faculty at Goshen College, just would reawaken or come back to me at different points in my career and continue to teach me. And I wonder if you could speak to that a little bit as you have gone on from Goshen College and pursued other things. What faculty relationships or student contexts, or what parts of your Goshen College experience so far have just kind of circled back within you at different times as kind of a guide or inspiration?
Thanks for the question. I think I was incredibly fortunate to be able to spend a fair amount of time with Dr. Doug Sherrick in the chemistry department. He was a wonderful mentor to me, kind of from when I first came onto the scene at Goshen College. And then certainly just directly relevant to the work that I'm currently doing. I started doing research with him, I think my second year at Goshen, and we were working to try and develop potential candidates for antimicrobial agents, antibiotics against some neglected tropical diseases. And so I was exquisitely interested in the chemistry and the research, but we really were working on things that were grounded in issues that are vastly prevalent throughout the world and disproportionately affect people in our world that are a little bit less fortunate than myself, surely, and that many of us here in the United States. A lot of the diseases that we were considering are prevalent in locations outside of the U.S. for sure. So that work has always kind of flavored the research that I'm interested in. I was again working on kind of anti-infective work at AbbVie, and then at the NIH worked primarily in oncology, but now as I'm starting my MD PhD and trying to decide what I want to do my PhD in and focus in my physician scientist career, those early days in work with Dr. Sherrick and conversations I had throughout the biology and chemistry department in our science and faith group, those are memories that come back as to what's kind of set the course of my current career trajectory and really encouraged me to follow this path.
Mm-hmm. Yeah. Well, you're not alone in appreciating Professor Sherrick.
And I'm missing, there's an entire list of just wonderful professors that impacted me while I was at Goshen, and many of whom I consider close friends.
Yeah. Well, thanks for that story. And it also reminds me, having been in a large research university and then coming to Goshen College, what a small college can do in terms of offering research to students, I think, on the whole, more quickly than a large research university does, in my observation, because the student faculty ratios are so much lower, and faculty are eager to work with undergraduates. And undergraduates don't have to compete with graduate students and postdocs for those research opportunities. So you're a great example of that as well.
Yeah.
Yeah. Yeah. So what are you thinking about for your future research?
I am not sure at the moment. Given the current COVID-19 environment, most research labs here are shut down.
Yeah.
I had arranged to have 2 rotations this summer with potential PIs for my PhD. One of them is wholly on hold, and the other were in discussion about what we might be able to do virtually, computationally, what we might be able to do outside of the lab. But I have had just one wonderful rotation the first summer I came in with an individual who does kind of basic biochemical research that we were applying to try and understand the structural biology of a protein that coincidentally is kind of induced to be expressed in us when we see a viral infection. So that was work that we were interested in before this pandemic, and I know they're currently working to see if there's relevance to COVID at the moment. But
right.
Unfortunately, I seem to be interested in perhaps too many things. So it'll be a bit challenging the next year or so as I have to nail down, a trajectory for my PhD and select an advisor and declare a department. At the moment, it looks like I will declare in the biochemistry department, and that's exciting to me.
Yeah, that is very exciting, and not an easy process to hone down to the one thing that you're gonna devote 3 years of your life to, or however many years it is in your program, and that's sometimes a little bit unpredictable.
Right. As someone who went through that process personally in the past, do you have any advice?
Well, pick something that excites you, because you're going to have to stick with it for a while. So I think it is a time to listen to some external advice and some advisors, but also to pay attention to which questions really switch on your own internal motivation, because as you know, PhD stands for perseverance, hard work, and determination, and there are going to be moments, if not months, when you're utterly sick of the research question that you chose. So the more motivational momentum you can bring into it, the better. But I think one of the reasons why the PhD process is valuable is that it is a discipline in sticking with the question, and of course, we often revise and keep tweaking the question as we go forward through research, but that discipline to stay the course, and to stay the course even when your data aren't telling you what you hoped they would tell you. Yeah. Some successful experiments disprove your hypothesis, and that's also part of research, part of science.
Yeah, of course.
Yeah.
Okay, well, thank you. I'll keep that in mind, and yeah.
Yeah, and the advisor matters. So pick somebody that you feel like you can imagine working with through thick and thin.
Yeah.
Yeah. Yeah. Oh, I'm so excited for you. What a time to be entering the work that you have wanted to do.
Yeah, I think so as well. I believe I might be as excited regardless of the circumstances, but in light of COVID-19, it's the discussion and the conversation has changed just slightly, and it's as tragic as it is to be really present in the hospital at this time. It's motivating to keep up the work and to one day hopefully become a doctor that can be directly helping in a crisis like this.
Yeah. And in whatever unfolds before us, 10 years and 30 years from now. I said to our graduating seniors in our virtual commencement yesterday that one of the things that gives me hope and confidence in this is this belief in the next generation of leaders and Goshen College leaders that are entering the world and the workforce. And it's such a delight to meet you. And you, like our graduating seniors, give me a tremendous amount of optimism about the way the world might unfold.
Oh, thank you.
Yeah. It's at my stage of life, you know, I'm more and more aware that of gradually sort of handing over the reins of organizations, institutions, culture, economy to a next generation, and that we all need you.
Well, hopefully we've been taking notes and listening to your guidance from your generation of mentors, and we'll do our best, I think.
Yeah, indeed. Well, Jacob, thank you so much for taking time out of your busy day. I know you must have many things pressing on your agenda today, from helping out in healthcare, in your present role as a first-year medical student, to studying and reading and staying healthy yourself.
Yeah.
So I
I'm staying busy for sure, but yeah, I'm doing my best and trying to keep on top of things.
Yeah. Well, I know I speak for many people. We love New York City and the people of New York. We love the energy and the creativity and the, you know, extraordinary talent, and that feeling of being swept up in crowds on the sidewalks and in subways and in performance halls. And we, all of America, all of us are rooting for our friends and family and loved ones and our GC alums in New York City.
Yeah, thank you. I guess I can share a bit. In our ER, we are seeing a bit of a flattening and some bit of a depression in our curve, which is encouraging slightly, but you know, everyone here is very weary. The situation here has been and continues to be pretty desperate, and you know, from our peak, I think of about 2015 was the top number of admitted COVID patients to our ER about 2.5 weeks ago. And that was right about when I first stepped into the ER. And it was a pretty stark and startling reality to see coming out of, you know, self-isolation in my room doing virtual classes. Yeah. Even now, the latest data from I think about 2 days ago from the official data was that we have over 1,400 patients still in our hospital system that are COVID positive, and majority of those remain because they need ICU level care, and that's an astounding number that, even though it's less than the 2,000 number that I reported before, it's still far beyond our capacity, and it's just been a heroic effort by many healthcare workers here in New York City and in New York State. While volunteering, I've talked with countless healthcare providers who have come from out of state. The respiratory doctor who brought the ventilators down from the ICU to the ER to help intubate patients flew in from Texas, and she noted that I reminded her of her son, who she hadn't seen for 4 weeks. It's just been a monumental and exhausting effort here. And like I said, things are looking up a little bit, but everyone is very hesitant to take the foot off the gas. And we're all concerned for how things will go once we relax social distancing. And yeah, overall, it's just been an incredibly sobering and kind of visceral experience, but also, I mean, an opportunity to really see some humans and humanity at its best in the care that we're providing, and trying to continue providing as many people are getting exhausted and
Yeah.
contracting COVID as well. So
Yeah. It has certainly reminded all of us of our vulnerability, of our humanity, of how much we love one another, and are vulnerable to loss. Jacob, you need to get back to your day, and so do I, but it has been so good to connect with you. And I know that our alumni will be inspired also to get a little window into what you are doing, and feel connected to you in that way. Thank you so much for who you are and what you're doing and what you're a part of in New York City. Our hearts are with you.
thank you very much.
Okay, bye-bye.
Nice talking with you. Goodbye.